The Target 12 investigators have uncovered new details showing hospital readmission rates are high among coronavirus patients.
A major concern as the state is seeing record numbers of overall hospitalizations, which is what pushed the state to open our two field hospitals. Target 12 investigator and managing editor Tim White joining us live in studio. Tim, we know a lot of people are being hospitalized because of the coronavirus. Many of them are getting better, then being discharged.
Right.
But your team got some data that shows many are ending up right back in the hospital. So what's happening? How does that compare in any way to other illnesses?
Well, Brian, our colleague Eli Sherman dug this one up. He found data from the Rhode Island Department of Health that shows roughly 7% of coronavirus patients statewide had to return to the hospital after being discharged. And some ER doctors that we talked to tell us the actual rate is closer to 1 of every 10 patients. What's really telling is that's on par with some other really serious illnesses such as congestive heart failure and pneumonia. And as to why, Brian, there are a number of factors. As you know, COVID-19 is a very tricky disease to treat. And we have seen people who are improving and then suddenly they take a turn for the worse days later.
But Tim, we're hearing though that some medical professionals are now trying to get creative and come up with solutions for this problem. So what are they working on?
Hey, Shannon, this is kind of interesting. Lifespan, the state's largest hospital network, is sending some patients home with what's called a COVID home companion kit. Essentially, if a patient is at risk of getting readmitted, doctors will send them home with a pulse oximeter, which tracks oxygen levels. They also get instructions on how to regularly report their symptoms. The idea is that better at-home monitoring could help alleviate some of the pressures right now on the hospitals.
All right, Tim, while we have you switching gears a little, your investigation into DCYF children at Bradley Hospital sparked a lot of reaction, including from some lawmakers now.
Yeah, Brian, to remind people, last week we revealed nearly 24 children in DCYF care have been stuck at the psychiatric hospital, and we learned those kids have not been receiving a formal education as required by law. Our report prompted this reaction from State Rep Mike Chippendale just yesterday.
And then what we're reading now, or we're seeing on WPRI, is that we're warehousing some of these kids in a psychiatric institution without any access to education.
Now, Chippendale was demanding more staffing at DCYF in the budget. That did not work out. I also talked to the incoming chair of the Senate Education Committee, who says they are launching an investigation following our report.
And Tim will have all the new developments on that Target 12 investigation coming up on 12 News Now at 5. Target 12 investigator Tim White, thanks so much.